So we thought we'd do a video on dental examinations this morning and showing the difference between doing a dental examination with sedation and without sedation. So to start with, we kind of start our examination as soon as we get in the stable, so we're looking at facial symmetry, any differences from side to side where the sinus compartments are. And we'll then have just a gentle feel of the temporomandibular joint, and then feeling underneath the mandibles, feeling for any bony swelling. On younger horses, that'll be sometimes eruption bumps and really obvious on the very bottom aspect of the mandible bone. So feeling along both sides and then right up along the inside of the mandible. In older horses is where they'll often get swelling if they've got dental problems on the lower jaw. And then feeling their submandibular lymph nodes as well, just to make sure that there's no enlargement of them and no pain on palpation. And then just moving around, having a feel inside their lips as well, making sure that there's not any masses or any obvious traumas to the inside where the bit will sit. And then also having a look at their incisor alignment. And this horse has just a very, very, very slight overbite. Okay. Then the next stage is having the house and gag on and opening up the horse's mouth. He's unsedated at the moment, so just go carefully and just open it gradually. I quite like to have a feel in their mouth before I wash it out, so I can feel where they're packing food. Can give me an indication of if they're packing food in an area in their mouth where there might be a problem for me to have a closer look at. He's got some slightly sharp points in here. It's just his 6-month check, so we're not expecting to find anything too dramatic. And we'll just get him washed out so that we can have a better look. So this is my view of what an unsedated horse is like to do a dental exam on. You can see how strong and mobile the tongue is. And now we're going to try and get a mirror in to look at every structure in the horse's mouth. So we probably sedate as a practice maybe 95% of the horses that we do dentistry on, and we find that we actually meet very, very few horses that will tolerate a full veterinary dental examination. So probably in the last 10 or 12 years, veterinary equine dentistry is really advanced. So we need to be able to make sure that we've got a suitably sedated animal, a sedated horse, so that we can get a full look at their teeth, making sure we can look at the pulp cavities, the infundibula, all of the structures which make up the teeth, and then perform the appropriate treatment. So you can see that straight away the tongue stayed nice and still. We've got Splash's head up on a headstand, so he's comfortable. We bring these headstands out on the yard with us so that it makes it easier. The owners don't have to hold them up. And most importantly, the head is at our eye level. So we're nice and comfortable, we can actually see everything as well, rather than looking up at an angle at everything. So we're just doing a full dental oral exam now. So looking at the occlusal surface with a mirror of each of the cheek teeth, you can see that his tongue's nice and still, allowing us to get the mirror right along the arcade, right the way to the back of his mouth. So once we've gone down the occlusal surface, we also go down the outside of each arcade. This helps us look for any diastemas, which are gaps between the cheek teeth where food gets packed down into the gum line into really painful pockets. Unsedated, the horse's tongue is just so strong that we can't get the mirror to stay still for us to focus on the area that we're trying to look at. So we're just systematically going down each arcade, looking for any abnormalities, and also checking for the routine findings that we're expecting. So some slightly sharp points on the outside of the upper teeth, and then we get some slightly sharp points on the lower arcades next to the tongue. So as well as checking the teeth when we do an oral exam, we're also checking the gums, so having a feel for normal attachment of the gums all the way around each teeth. We'll have a feel of the tongue right to the back of the tongue, make sure that feels normal. Getting the tongue off the sides of the lower teeth, just having a feel and a look all the way back on both sides. And then also having an inspection of his hard palate all the way to the back, and then his soft palate right at the back of his mouth. And again, with the tongue moving round unsedated, you don't get a really good appreciation of any problems going on there. So as well as having a look in with the mirror and a feel in with our hands, we're also going to get some instruments in. So we probe along the surface of each tooth, making sure that we've got a really nice glassy, smooth appearance and no defects, which might indicate some abnormalities, some pathology in the teeth. And it gives us an idea of then, if we do meet any pathology, to go and have a closer look. And again, you can see how sharp the end of that pick is. We don't want that going into an unsedated horse's mouth, because we've got some fairly important arteries in the top of the palate that we like to leave alone. So here you can see my picks just up into one of the infundibulum, and this has just got some slight caries in it, so probably just a grade 1 caries that we're just going to be keeping an eye on that every time we look in this horse's mouth. So you can just feel as you slide along here on normal tooth, and then we get into a defect that I can get my probe into.